Can you talk a little bit about exactly what the local, national, and international response has been so far for cardiovascular disease patients?
Obviously, it's been overwhelming response, and I think it's also been very gratifying to see how cardiovascular clinicians have really been without borders in trying to communicate the positives and the negatives with this pandemic. And specifically, as we were discussing a bit earlier, through the ACC and through our other medium, we have been able to communicate with cardiologists and cardiovascular clinicians internationally. We have been having regular webinars several times per week, almost daily, with cardiologists in China and the Chinese Cardiovascular Association, with their association with the American College of Cardiology, and also with the Italian Cardiology Society as well, and learning from them, what are the worrisome touch points that we need to be aware of, and what are the better ways that we can treat, and how soon we should treat our cardiology patients. Because one of the things that's been surprising and somewhat shocking is that patients or people with prior heart disease are the highest risk category. And I found that somewhat surprising, that it's almost double those with prior cancer or diabetes or high blood pressure, kidney disease, and those sorts of things. It's almost 11% mortality rate in patients who contract COVID-19 who have had prior heart disease. And, there's various questions about why that may be. And scientists and clinicians are trying to work through that, various theories and so forth. But what we do know are that they are in the highest risk category. And so therefore, special attention to identify these patients early and to get them the care they need, the support they need for their hearts, and to avoid heart failure and other problems that unfortunately occur with this pandemic as well for people that contract COVID-19. So that's one of the important lessons that we've already learned, are that this is the highest risk category. And of course, we know that as we get older, above 60s, 70s, and 80s have like a 15% mortality rate with this disease, apart from having heart disease. So you can put some of these confounding factors together, and it can get quite worrisome. So we're trying to be as prepared as possible. We're learning things about, obviously, about social distancing, but also in the hospitals. How do we take care of patients, and how do the healthcare workers protect themselves, and how do they protect the patients, whether they may also actually be asymptomatically with the virus and so forth. So we're obviously we all know about the hand washing. We know about the 6-foot distance. We hope so by now, and avoiding avoiding social contact, but also where we need to wear masks, where we need to think about airflow within the hospital and the operating rooms and the cath labs, and also about the special respirators or N95 masks, as well as the personal protective equipment for the individuals that are taking care of these seriously ill patients. So we're learning a lot from Korea and China and Italy, and of course the West Coast, which has gotten hit pretty hard, particularly Washington State and now New York. And so we are meeting daily virtually and trying to learn lessons to help avoid and flatten the curve more, as we know, to try and really sort of break the impact of this virus.
And it's fascinating that you guys are able to connect with the countries and the officials and experts most afflicted by this right now, and understand exactly what's happening to them and what we can learn from potentially the burden or not mistakes, but just really missteps that may have been made early into it, to respond to it, just continue to learn as it spreads in the country. And it seems concerning with cardiovascular disease, because I think we sometimes think of it as a uniquely American problem, the significance, the breadth and burden of cardiometabolic disease in the country. What can we learn, do you believe? What's our potential to learn from this pandemic as it relates to cardiovascular disease. Is there a chance we learn more about the role of an inflammatory respiratory disease like this and its effect on cardiovascular disease risk patients, or is it the other way around? Are we learning more about the disease itself because of cardiovascular risk?
I would say, more importantly, we're learning about the effects of the virus on cardiovascular disease. We know that patients that, if examined closely, that are symptomatic with COVID-19, that they may have as much as 40% involvement in their heart with the virus. And that's, striking, shocking, if you will. And many of these highly sick patients, and let me just say that's in that 5 to 10% range. It's not everyone, thankfully, but will develop heart failure. And we're learning that again from our partners abroad that early support of these patients with ECMO, this mechanical assist device for the heart, until these patients are recovered, so that they can have support from mechanical support, this extracorporeal membrane oxygenator, which not only helps support the heart, but helps support the breathing, because as we most know is that it affects the lungs, and so it helps with breathing as well. So we're learning a lot. We're learning to be ready. We're learning to have the teams ready, and to have the rooms ready, and to know when to proceed, and to proceed early on these patients. And that many of these, if you can get them early and get them supported well, will recover after several days and be able to come off the ECMO and the respirators and so forth, and be able to return to normal living. So we're learning a lot. We're trying to stay as prepared as possible. And again, we don't know exactly why the heart is affected as much as it is. I mean, it seems obvious, that it's a respiratory illness. We understand why the lungs are affected, but it does seem to go to the heart a lot. And it also seems to affect those people that have had high blood pressure. And there is some concern that there may or may not be a relationship to heart medication as well, but that also could just be that that's a marker for patients that have heart disease.